Imagine going on a luxury cruise vacation only for passengers to suddenly fall seriously ill from a rare virus linked to rats and mice. Now people around the world are asking one question: what exactly is hantavirus? And should we be worried? Today, we're breaking down everything you need to know about this dangerous virus, how it spreads, the symptoms, who's most at risk, and whether this could become another global outbreak. Let's get into it. What is hantavirus? Hantavirus is not just one single virus. It's actually a group of viruses found mostly in rodents like rats and mice. The name hantavirus comes from the Hantan River in South Korea, where the virus was first identified decades ago. Although infections are considered rare, they can be extremely serious and in some cases deadly. Most infections happen when humans come into contact with infected rodent urine, saliva, or droppings. This means people living or working in places with rodent infestations are usually at the highest risk. Where did this recent outbreak come from? Recent reports connected several cases of hantavirus to a cruise ship traveling near South America. However, experts still aren't completely sure where the infection originally started. Some passengers reportedly traveled through areas in Argentina and Chile before boarding the ship, regions where a dangerous strain called the Andes virus has previously been detected. In fact, health experts once traced an outbreak in Argentina back to a single infected person at a social gathering. That outbreak eventually led to dozens of infections and multiple deaths. This shows how serious certain strains of hantavirus can become under the right conditions. How does hantavirus spread? This is the part many people find frightening. Hantavirus can spread through tiny particles in the air. When infected rodent urine or droppings dry out, they can break apart into microscopic particles. If someone breathes those particles in, they can become infected. So technically, the virus can become airborne in contaminated environments. Most cases still come directly from exposure to rodents, especially in places like abandoned buildings, farms, cabins, forest areas, poorly ventilated spaces with rodent activity. Some rare strains, especially the Andes virus, have also shown limited human-to-human transmission, but experts say this is uncommon. What are the symptoms? Early symptoms can feel very similar to the flu. People may experience fever, fatigue, muscle pain, headaches, chills, nausea, dizziness. But then things can suddenly become much more serious. One form of the disease attacks the lungs and can make breathing extremely difficult. Another severe form targets the kidneys and may cause low blood pressure, internal bleeding, kidney failure. In the worst cases, the infection can become fatal. Some reported mortality rates for severe strains are alarmingly high. That's why early medical attention is extremely important. Who is most at risk? Anyone can become infected, but certain people may face greater danger. This includes elderly individuals, people with weak immune systems, those with existing health conditions, workers exposed to rodents regularly. People living in rural areas or environments with poor sanitation may also face higher exposure risks. How do doctors test for it? Doctors usually use PCR testing to detect hantavirus. Many people became familiar with PCR tests during the COVID-19 pandemic. These tests look for the virus's genetic material and help confirm infection quickly and accurately. Is there a cure or vaccine? At the moment, there is no specific cure or widely available vaccine for hantavirus. Treatment mainly focuses on supportive medical care. Depending on how severe the illness becomes, patients may require oxygen support, intensive care, mechanical ventilation fluids, and monitoring kidney dialysis in severe cases. The earlier someone receives treatment, the better their chances of survival. Should people panic? Right now, global health organizations say the overall risk to the public remains low. This is not being treated like another COVID-style pandemic. However, health experts continue to monitor the situation closely, especially because some strains can be extremely dangerous. The important thing is awareness, not panic. Simple precautions can greatly reduce risk. Avoid contact with rodents. Keep living spaces clean. Wear masks and gloves when cleaning infested areas. Never sweep rodent droppings dry, since that can send particles into the air. Outro hantavirus may be rare, but it's definitely a virus the world is paying attention to. Understanding how it spreads and recognizing symptoms early could save lives. What do you think? Should governments be taking this more seriously, or is the fear being exaggerated? Drop your thoughts in the comments below. And if you found this video helpful, don't forget to like, subscribe, and turn on notifications for more health updates and medical explainers. Stay safe, and I'll see you in the next video.